On today's episode of The Bat Signal, the battalion wins over 26 awards this year's TIPA contest. News writer Mia Putnam talks about the fentanyl crisis and a new artifact might be added to the A&M Association collection. Howdy Ags and recovering 2%ers, and welcome to another episode of, you guessed it, The Bat Signal. I'm Kenzie Finch, this week's host, and today we're going to be diving into some of these interesting stories. So I have Michaela Rush here with me today, our editor-in-chief, to talk about the recent convention that the battalion won a lot of awards at, the Texas Intercollegiate Press Association Convention for 2023, or TIPA. Michaela, thank you for coming.
Thank you so much for having me.
So tell me a little bit about the awards that we won.
Yeah, so overall, the battalion and its staff earned 29 awards at the TIPA convention this year, which is so exciting. There's a lot of different types of awards across different categories for writing, design, photography, and audio production. And most notably, we did win 2 Division I Overall Excellence Awards.
Which is super exciting. For those of you that don't know, that basically means that we won best overall in the whole convention for the state of Texas in our division.
Yeah, and those 2 awards honored both our print edition that we publish weekly, as well as our 2 podcasts that we worked on last year, The Bat Signal and Home Turf. So really exciting to be here on an award-winning podcast.
Love hearing that. Thank you guys for tuning in to our award-winning podcast. Is there anything else that you would like to add about the convention?
It was just a really great opportunity to get professional experience, getting to talk to people who are in the field, both who've been working in there for, multiple decades, and people who just graduated. I got to learn a lot about InDesign, a little bit about photography, a little bit about writing. So overall, just a really positive experience, and I'm looking forward to next year's TIPA convention for all of our staff members who will get to go.
I just want to throw this in there, but Michaela said she cried when we won those 2 overall awards.
I did. Last year was really, really challenging, so it was awesome to just kind of have that recognition that we've been putting in the work, and our effort is coming across in what we've been publishing. So I'm really proud.
Perfect. Well, thank you so much for coming on the podcast.
Thanks for having me. I appreciate it. The award-winning podcast.
I have news reporter Mia Putnam here with me today to talk about the fentanyl story that she covered. Hi, Mia. Thanks for coming.
Thanks for having me, Kenzie.
So obviously you're here to talk about the rise in fentanyl use. Can you tell me about what you found?
Yeah, of course. So the first thing I really discovered about fentanyl when just trying to find out really what it was that it's something called a synthetic opioid. A synthetic opioid is something that is manufactured in a lab instead of that is extracted from something like a plant, like heroin is. Which was told to me by Dr. Jun Wan, a professor in the Department of Neuroscience and Experimental Therapeutics at the Texas A&M School of Medicine. He also communicated to me a lot about what really fentanyl is. Again, that it's a synthetic opioid, but also that it's about 50 to 100 times more potent than heroin, which is why fentanyl can get into the brain easier, breaking something that he called the blood-brain barrier, and is much more dangerous just because of that.
Perfect. So how has this rise? Do you have a number on the rise of these numbers?
Yeah, of course. So according to the Centers for Disease Control, or the CDC, there were over 75,000 fentanyl overdose deaths in a 12-month period between April 2020 and April 2021. Specifically in Texas, the Texas Department of State Health Services reported that there was a 120% increase in deadly fentanyl overdoses since 2020. And we've seen this number continue to rise, especially after the COVID-19 pandemic in 2020, which is why some professors like Dr. Alonso, who I also interviewed, said that the COVID-19 pandemic really exacerbated the effects of this opioid epidemic and overdoses from fentanyl.
Right. So how have people been accessing this synthetic drug?
Yeah, so like I just mentioned, I interviewed the Professor Joy Alonso, who is a clinical assistant professor and is also the co-chair of the A&M Opioid Task Force. She said that fentanyl is manufactured largely by cartels. This is mostly done in bordering towns between the United States and Mexico, where they're often able to easily get it into the United States to be used by young adults and teenagers that live in these border towns. She said that they usually manufacture it by buying these precursors, which are basically just ways to make the pills look like other typically used pills like Xanax or ADHD tablets. And they're typically shipped overseas, and they are not at all registered, or they do not have to be looked over by the FDA or anything like that, so they're very easy to make counterfeits, which is why the cartel is able to make a lot of them. And a lot of these overdoses in Texas are actually not due to addiction, but are due to buying these fake tablets, often made, again, by the cartels. And Dr. Alonso says that a lot of times this is not like a teenagers get addicted situation. This is often, maybe they're really stressed from school, they're really stressed from sports, they're having, social troubles, as many of us do at that young age. And then they, have a friend that says, hey, just try this, it'll help make you relax. And sometimes that's just enough to cause them to overdose.
So is there a way to counteract these effects of an overdose?
Yeah, so for a lot of opioids, what the FDA has required was naloxone, and naloxone is, again, an approved medication that is able to reverse opioid overdoses. It's an amazing drug, and it can actually be bought even at by anyone at regular corner stores or pharmacies like Walmart and H-E-B. Anyone can walk in and buy one. You don't have to have a prescription. Sadly, like Professor Alonso has said, however, they are kind of expensive, usually between $80 to $100, which is often a prevention to be able to actually help people be able to get naloxone. So they're hoping to reduce that cost in future years, especially in Texas, where opioid deaths have risen. But the A&M Opioid Task Force also works to provide naloxone training, specifically to students or to student organizations on campus. They are actually having an opioid awareness week coming up, I believe the week of April 10th. And so that they will be offering university-wide training to anyone who wants to come out and learn how to use it. It's relatively easy to use. It's usually like a nasal ingestion, so you think about something you take for your allergies, usually you squirt it into your nose. That's how the naloxone works. And so anyone can usually easily administer it. However, they do suggest that you take the training just so that you know the background and how to best help someone. And then, of course, if you do see someone overdosing, you should always ask if anyone has naloxone, but the first thing you should do is call 911.
Right.
And so, again, if you are anyone listening to this and you are suffering with addiction or substance abuse, or know someone who's suffering with addiction or substance abuse, there is a free helpline from SAMHSA, which is also called the Substance Abuse and Mental Health Services Administration, at 800-662-4357.
Perfect. Well, thank you so much, Mia, for coming on the podcast and for sharing some of your insight into this situation.
Of course. Thank you so much, Kenzie.
So our last story is about a cool new antique that may be donated to A&M. A humidor, or a container that keeps cigars moist, was recently donated to A&M by Henry Kirby, HK, and Roberta Robbie Pitts. Associate Director of Forest Resource Development Bill Oates said that back about 100 years or so, around the Coolidge administration, they had remodeled the White House to remove some of the materials that was installed after everything was burned in the War of 1812. They had made various items out of the material that came out of the White House, and they would give them away to people as gifts. According to clippings from the Baltimore Sun provided by Oates, 2 humidors were originally built out of the White House roof materials, in addition to some other souvenirs. The humidor at A&M, Oates said, may be one of the last extant samples of the former White House. Well, there you go, Aggies. This week's contributors are Michaela Rush, Mia Putnam, and Jack Lee. Be sure to tune in next week for the latest news updates, as well as our sports podcast, Home Turf, and our LNA podcast, Calculated Culture. This is Kenzie Finch. Thanks, and gig 'em.